the recording. Thank you. Good morning, everybody, or good day. I am Susan Gallagher-Lepak. I am the Director of Education at NANDA-I. It's a pleasure to have you all here. Just so you know, this session will be recorded so that folks can view it at a later date if desired. Welcome to the NANDA-I Knowledge, a webinar series to connect and inform about the NANDA-I taxonomy and terminology. This is the second webinar in the fall 2022 series. Just so you know, the next webinar is on November 10th. I'm very excited to introduce Christine Spisla, NANDA-I Director of Informatics. Christine brings much experience as a clinical information consultant, SNOMED terminology manager, and nurse clinician. Know that she will present some information and then a Q&A will follow Christine's presentation. Feel free to type your questions in the chat during the presentation and I will help facilitate at the end so that Christine can address your questions at the end. With that, I will turn it over to Christine. And again, thank you all for being here.
Thank you, Susan. Welcome, everyone. Good morning and hello to those of you in Europe and around the world. We are going to talk about SNOMED CT. It is in the news lately. The adoption internationally continues to grow. So it's exciting to see interest in this topic at this level. So let's get started. We've got a lot of material to cover. We're going to go through what is SNOMED CT. We're going to talk about the terminology structure. It is not as scary or as complicated as you think it might be. You know, as I describe it, we're going to talk about the role and where NANDA resides within the SNOMED CT terminology. And then we're going to talk about how you can get involved because there's many levels where you can get involved. So let's get started, jump right in. SNOMED CT is actually an acronym. It stands for Systematized Nomenclature of Medicine Clinical Terms. SNOMED has evolved over the years. It started as a way for pathologists to standardize their pathology reports so that from hospital to hospital, it was being interpreted the same way. And it continued to evolve and include more and more of the patient's story and the patient experience, and also including nursing terminology to get to where it is today. It started off being created by a pathology organization within the United States. And now the last time I heard, it's been adopted by 45 countries worldwide. So that's pretty exciting. So I always love to give a shout out to Florence Nightingale. She was the first statistician and the first informatician. You see her there at her computer. It's a bit of an old computer because she doesn't have her flat screen yet. And she did really understand and value clinical documentation, even back in that date is wrong. It is 1896, not 1986. How did I not catch that last night? All right. So let's talk about what is SNOMED CT. It is a comprehensive clinical terminology that gives you terms to describe the entire patient experience. So the first thing people always think about are diagnoses, but it also talks about procedures, body structures, how to document a patient's functional status, their allergies, their body structures. It comprehenses everything. And it gives you a consistent way to store it, to retrieve it, and to aggregate it. Because really, with the electronic health record, we now have this large volume of data, and it really doesn't do us much good unless we can kind of reuse that data for purposes for research and for the greater good. And it helps structure the way the clinical record is created and documented so that if you are so that it increases the interoperability of data across healthcare organizations and also worldwide. So I've pilfered a couple of slides from the SNOMED CT group, and they've given us additional information here. And they show that here that it provides a level of detail, because at different areas where you do documentation, different levels of detail are required. And it with that, we can encode the record at different levels of detail, and then that helps with abstraction later on, not only for administrative purposes, but for research purposes, or even for just kind of looking back at the patient record when the patient is moving from healthcare organization to healthcare organization. So this is a great slide and a great example why we need structured terminology, because believe it or not, we do document a lot of ambiguity in our clinical record. For example, I worked the maternity ward, I worked labor and delivery, I worked mother and baby. So we very frequently documented the word fundus, and we all knew what the word fundus meant. And I said, the fundus is firm, fundus is at the umbilicus, and we knew what we were talking about. But someone on the med-surg floor may be talking about a different fundus, someone in ophthalmology may be talking about a different fundus. And so here, the word fundus is a synonym for the fundus of the gallbladder and all these other body structures here. And then within the clinical record, the way the clinical record is managed on the back end, and I'll show you some examples of that, you can still use the words that you use in clinical documentation, but within the back end, they've disambiguated it, because they've coded that word fundus to the proper one that you're talking about. So this is where the structured terminology starts to make sense, and you start to see the value of that. So let's move on to the terminology structure. And this is where we're going to spend the bulk of our time. And I'm really going to highlight where the NANDA nursing diagnoses reside within the SNOMED CT terminology. So when we talk about SNOMED CT and the basic elements, we're talking about concepts, descriptions, hierarchies, and relationships. And these four elements really are the foundation, the framework for SNOMED CT. And we're going to take a deep dive into each of these so you understand what's involved. So let's talk about what is a concept. A concept is a unique idea. And that unique idea has been given a code, and that code doesn't have any meaning by itself. It's just a randomly assigned number. Okay. So SNOMED is a set of codes. It's just a whole bunch of codes, and those numbers don't mean anything on their own until we associate them with terms. And those associated terms are called the descriptions. So you see there in the middle of my screen, we see gastric ulcer. And gastric ulcer has that associated term with it. And those numbers don't mean anything. You know, when we think of our phone numbers, the prefix numbers have meaning and the back end numbers have meaning. And within the SNOMED codes, there's no meaning whatsoever. And these numbers support the messaging and the secondary use of the clinical documentation, and the descriptions support the clinical documentation. So let's kind of start diving a little bit deeper into this. So each concept has a unique numeric identifier, which we saw there in our example of gastric ulcer. And then it has a set of human readable terms, which are these descriptions. And it's going to have multiple descriptions, and we're going to talk about those. Then it has one or more relationships, and the relationships create the definition of the concept, so that this term has meaning, and so you can understand what they mean by this term versus this term. And I've got a really good example of that later on in our presentation. And this identifier, this number, it ties together the set of descriptions, and it ties together the set of relationships. Now, I know I'm starting to lose some of you, so I'm going to show you what that looks like. And so here we have our example. I tried to look for a nursing diagnosis example, but this one, it really does a good job of describing what I'm trying to talk about here. So our concept here is cholecystectomy, and our concept identifier is right here. CID stands for concept identifier. And here it is. And then here we have our descriptions, and here we have our relationships. And you can see that each one of these descriptions and relationships has its own unique identifier number. And it's okay. We're going to talk about each of those. Okay. But so here I'm trying to kind of like build the knowledge that of SNOMED CT that we're talking about this morning. So this is really what a concept looks like. So we're going to talk more about this. We're going to keep diving in. So we know what a concept is. So let's talk about what a concept is not. And that's very important. So a concept is not a narrative about the patient. So if we look at our first example, we're talking about the patient status. But my second example here is something that I've pulled from one of the skin assessments, the validated skin assessments, that someone never eats a meal, takes fluid poorly, and does not take a liquid supplement. Those are three separate ideas that have kind of been put together in one term, one thought idea. So this is not a concept. This is a story about the patient. And a concept is not a complete sentence. We see in our example here. And it's certainly not something that can mean different things in different situations. And because that really is what affects retrieval. And then you're going to have your data isn't going to be clean if you're using an ambiguous term. And it cannot be disjunctive. So it cannot have an and or, because skin infection or infection of the skin and mucous membranes is different than an infection of the skin or mucous membranes. There is a difference. So we now know what a concept is and a concept is not. So how do you use it? So here's an example of a drop-down list in an electronic health record. And unfortunately, my example is a little old, but it still works. And so on the drop-down side, the clinicians are seeing the list here of these different conditions or these different diagnoses. But on the back end, the people who work in IT, information technology, they have applied these concepts, the SNOMED concept IDs, to these terms that the clinician is selecting for. So the clinician is not responsible for selecting the right concept identifier. They're just still documenting like they would have documented before. And SNOMED is in the back collecting this information. So let's look at it a little again. So, and we can use this example thinking about the assessments that we do in nursing on this as well. And in nursing, we can, if we think about this as a fall risk assessment or a skin assessment, again, we have our drop-down lists. And this is where the nurses just need to document as they always did. And in the background, those SNOMED codes are being applied so that when you're doing data retrieval for your nursing research projects later on, those codes are there for you. Okay, so let's move on to descriptions. So the description is the human readable term for the concept. And each concept has a fully specified name. And that fully specified name unambiguously names that concept. And the fully specified name also has the hierarchy tag, which tells you what hierarchy this concept resides in. And so and we're going to talk about the hierarchies a little bit later on as well, because that's important there. And we also have a preferred term, and the preferred term is most often that fully specified name without the hierarchy tag, but there are some instances where the preferred term is going to be different than the fully specified name, and I have an example of that. In addition, a concept may have one or more synonyms. Those synonyms are in there to help you find the concept. A SNOMED CT concept will not have attached to it every possible synonym that's available in every language. It's just there to help with retrieval. And I'll talk about that a little bit later on. And as I showed in my example before, each of those descriptions has its own unique identifier. So here's a great example of, we've got our concept of myocardial infarction. And here's the preferred term, which is the fully specified name without the hierarchy tag, and then all the different synonyms that are attached to it. Because myocardial infarction is a great example because there are so many different ways that we can say, we can express the term myocardial infarction, but we're all meaning the same thing. And this is kind of also showing the value of SNOMED CT, because as you're building your electronic health record, if yours is more patient friendly and you would prefer to show heart attack on your display for the person who's doing the document, you can use that term heart attack, but it will still be connected to the same description that a clinician would use when they use the word myocardial infarction. So hopefully this is all kind of starting to make sense and putting it all together for you. So let's go back to our example of cholecystectomy and then our example. So here's our concept identifier. The first one is our fully specified name, and it has its own concept identifier, description identifier, excuse me. And then each of these descriptions have its own identifier. And all of these descriptions are connected to this concept identifier. And this is all done on the back end. And if time allows, we'll even not always the same. Now, this is definitely not a nursing term, but it is a really good example. This is a laboratory term. SNOMED did start in the laboratory with pathology, and the fully specified name is this big, long lab procedure level. But the preferred term is just a little more abbreviated using an acronym. However, this big, long term as the fully specified name is in there as a synonym, but without the hierarchy tag. So here's an example of where the fully specified name isn't always the same as the preferred term. So we've talked about concepts, we've talked about descriptions. Let's move on to hierarchies. SNOMED has 19 top level hierarchies. So I know what you're thinking, and those of us in the United States and South America, it's a little bit early to have to deal with 19 top level hierarchies. I understand that, and we're going to break this down because most of these hierarchies are there to support the main ones, and the main ones, and so I'm going to show you. So this is a breakdown of the number of concepts in all of the hierarchies. And I know the type is a little bit small, but the clinical findings hierarchy, and the clinical findings hierarchy is where you're going to find your NANDA nursing diagnoses. And this is the biggest, volume-wise, this is the biggest hierarchy there is. The next biggest is procedure. So if you're thinking about your clinical documentation, that's your nursing diagnosis and your nursing interventions. And then the next biggest one is the body structure, and the body structure hierarchy is there. And in our cholecystectomy example, I'm going to show you why the body structure hierarchy is so important. And so that's why there's so many of them. And then the next highest ones are substances and organisms. And again, this is to support the primary purpose of SNOMED when it was created is for the lab. So again, there's 19 hierarchies, but you don't have to know and understand all 19 hierarchies, just the big ones. So which are the ones that you need to concentrate on? So the most commonly used hierarchies in SNOMED CT, the clinical findings hierarchy, remember I showed you, it's the biggest one. This is where our nursing diagnoses reside. The procedure hierarchy, and this is where all the surgical procedures, our nursing nursing interventions are there. The events hierarchy, and I'm going to talk about that. That's why there's a little asterisk there. It's not a big hierarchy because I didn't point that out in our little pie chart there, but it's important, and I'll tell you why. And then organisms and substance, which the nurses don't necessarily document on. So let's take a deeper dive into these most commonly used hierarchies. So the clinical findings hierarchy contains clinical terms to describe normal and abnormal clinical conditions. So this is where your physical exam hierarchies are, anything for physical exam findings, excuse me. From our nursing assessments, we do a lot of assessments. All of our assessment findings are going to be in here. Definitely our nursing diagnoses are here. And when you see something from the clinical findings hierarchy, if you look at my example here of dry skin, it will have a findings hierarchy tag attached to it. You will also see concepts with a disorder hierarchy tag attached to it. Within the clinical findings hierarchy, there is a sub-hierarchy called disease. Anything under the disease hierarchy is necessarily abnormal. And when it is necessarily abnormal, it has that disorder hierarchy tag on it. So for dry skin may or may not be a good thing, but definitely, so it's got the clinical findings hierarchy on tag on it. But dry skin dermatitis is obviously an abnormal finding, and so it's got the disorder hierarchy tag. And the reason and how it gets that hierarchy tag assigned to it is it's a whole nother webinar. So if you're interested in that, chat, we'll have coffee. I'll tell you about that. But we're not going to cover that this morning. So let's go for procedures. Procedures are things we do for the patient, do to the patient, for the patient. They're administrative, they're surgical, they're medical, they're diagnostic. As nurses, we do a lot of patient education, and definitely our nursing interventions are here. And so anything from the procedures hierarchy will have that procedure hierarchy tag attached to that fully specified name. Moving on the events hierarchy, remember I told you I was going to address this. Events used to be classified under clinical findings, and then the editorial board made a decision to create its own hierarchy. And events is anything that happens to the patient of record. It's not a big hierarchy, but there are some important things to nursing in this hierarchy. So definitely the big one, patient falls, death is there, exposure to anything that might affect the patient's health care condition, any kind of abuse here. It's a small hierarchy, but it's noteworthy. Obviously, they probably put COVID-19 or the pandemic, but pandemic would be not the patient of record, it would be the community. I haven't poked around for COVID specific concepts, but SNOMED International was highly responsive to the COVID pandemic and added terms very quickly. And I believe they did a special release just so that the clinicians can have coded terminology to document for COVID. All right. And then I didn't cover substance and organisms because nurses don't do a lot of documentation on that. So in documenting the nursing process, so when we're assessing our patients, when we're applying nursing diagnosis to the conditions that we're finding with our patient, we're going to find those terms in the clinical findings hierarchy. And this is also, and I'm going to say it again, this is where you're going to find your NANDA nursing diagnoses. And then also, when you're creating your care plans and determining your nursing interventions, you're going to find those concepts in the procedure hierarchy. And when you are looking at your patient outcomes, seeing if they've achieved their goals, identifying goals for your patient, you're going to find those in the observable entity hierarchy. We haven't really talked about the observable entity hierarchy because this is NANDA and we're focusing on the nursing diagnosis. Again, if you'd like to talk about goals or interventions, call me, we'll have coffee and I'll talk to you about it. Okay, so let's move on to relationships. Relationships are another way to apply diagnose or apply definitions to the to a concept. And there's two different kinds of relationships. There's the is a relationship, and then there's the defining attributes. And we're going to talk about that. Here in our diabetes mellitus example here, we have, I'm just going to, it's just an example to kind of introduce the concept. And here we have the finding site. Remember how I talked about the body structure being so big? So diabetes mellitus has an associated body structure of the endocrine system. But I'm going to give you some more examples to help you kind of get your arms around that concept. So there's two different kinds of relationships within SNOMED. There is the subtype relationship. It's also called the ISA relationship. It's also called the parent-child relationship. And it, this is the one where it talks about, it specifies that, you know, the subtypes of concepts. As you go down that that hierarchy, the concept gets more specific, more defined, more granular. And as you go up the hierarchy, it gets broader and broader and broader. So for example, a Band-Aid is that's a bad example. I'll find some examples for you for that. And my coffee hasn't started working yet, my apologies. And then there's the attribute relationship, the defining attribute. And this is where it specifies further detail about the concept, and it links across hierarchies. Because remember our diabetes mellitus example before, diabetes mellitus is a disorder, and our finding site came from that body structure hierarchy. And it gives you more information about, you know, maybe like what is the site of this procedure, or you know, what is the methodology for this procedure, versus a subtype relationship stays within that same hierarchy. So if we're thinking about our clinical findings hierarchy, and we're thinking about going granular, impaired skin integrity is a type of skin disorder. And because there's multiple skin disorders, but impaired skin integrity is just one type. And then under that impaired skin integrity, we can say that there's a pressure injury. I have more examples so you can visually see that. I happen to be a visual person, so I expect that you may be as well. And here's a great example that came in just in time. So here's an example of our ISA relationship, our parent-child relationship. So we can see here, we're going to use our cholecystectomy example again. And as we go up the hierarchy, we can see that our concepts are getting broader and broader, because a cholecystectomy is a type of operation on the gallbladder, and the operation of the gallbladder is a type of procedure on the abdomen. And we see that they all have the same procedure hierarchy tag. And so this is how the hierarchies are created in SNOMED. They start off very broad, procedure can be anything, and then they start to get more and more granular as they work their way down the hierarchy. So let's move on to defining relationships. So here we're using our same cholecystectomy example, but our defining relationships, here we've got our method, and our method is an excision, and the excision comes from a qualifier value hierarchy. Remember how I said earlier how the defining relationships come across different hierarchies to provide the definition of the concept. And we're doing this excision on the gallbladder structure, and our cholecystectomy is an operation on the gallbladder. So looking at our ISA relationship and defining attributes, we know exactly what a cholecystectomy is, even if we hadn't heard of the term before, because it's telling us that it's an operation on the gallbladder, and you're excising that gallbladder structure. So hopefully this is all starting to make sense to you. So let's kind of like look at this. That what I had before was a very simplified view. Now we're looking at the actual view of the cholecystectomy term, because there can be one or more ISA relationships. And here for cholecystectomy, it does have two ISA relationships, and it's a procedure on the gallbladder, and it's an excision of the biliary tract with our defining relationships down here. So I've done a lot of talking. I'm just going to take a breath right here, right now, just so you can kind of absorb all this information. So what we've gone over is we've gone over the concepts, we've gone over the hierarchies, we've gone over the defining relationships on this, on SNOMED CT. And so this is how it kind of all comes together. So hopefully you're starting to see that, it's not as complicated as you may have thought it was. And let's go back to our example here again. So we've got our descriptions here. And so these are these different human readable ways of describing a cholecystectomy, but here are the relationships that help define what this term cholecystectomy is. And so let's stop here for a moment, because it's not only the definition of the term, but these defining relationships can be used for retrieval for secondary use of these terms if you're doing any kind of research. So let's say you're doing a research project on a nursing intervention for I'm going to use my pressure injury again, and you want to know everyone who has a pressure injury of the lower extremity. And so here, using SNOMED CT, you can work with your IT staff, and they can pull all the clinical records where the defining relationships equal a pressure injury of the lower extremity. You don't have to tell them each and every concept identifier to pull for that. So hopefully, this is all starting to make sense to you. So we talked about what a concept is and is not. Let's talk about what relationships, kind of the parameters of relationships. A relationship in SNOMED, so I'm going to go back to my previous, all of these relationships need to be necessarily true for a concept. And I've heard back when I worked on the SNOMED CT terminology, I would get requests coming in, and one of them, nausea is not a defining characteristic of a heart attack. You know what? You're absolutely right. It is not, because it is not part of the definition of a heart attack. It might be a symptom of a heart attack, but it is not a defining characteristic of the definition of a heart attack. And that's why you're not going to find any relationships between the symptoms of a disorder and the disorder themselves. Because, with a heart attack, you may or may not have nausea, but again, nausea is not a type of a heart attack. Whereas in our appendicitis example here, appendicitis always occurs in the appendix. It doesn't occur anywhere else on the body. And each of these relationships, like I showed you in our example earlier, has a unique identifier. And again, it's the combination of these ISA and defining attributes that define a concept's logical definition. And I want to kind of concentrate here on this ISA relationship. There's been some news lately in SNOMED CT where the nurses got involved. I'll share that with you toward the end, and that's where this ISA relationship is really, really important, because nurses save clinical documentation. Okay, so relationships help provide the definition. Remember when I told you earlier, I have a really good example to help show you how the relationships help define a concept. So here we have two very similar disorders. We've got chickenpox and we've got shingles. And both of these disorders are caused by the herpes virus, and they are both an infection process. But if you look at the defining relationships, you can see that these defining relationships, and I'm not going to talk you through it, I'll let you read this yourself, but these defining relationships help you differentiate between chickenpox and shingles and provide the definition to these terms. So I know I've done a lot of talking, so hopefully you're getting your arms around this. So let's move on. Okay, here's another great example. This is where I'm starting to get a little advanced, but I'm going to walk you through it. So this is this description logic, and the description logic, it enables inferences, and I'm going to talk about those inferences, but it also allows you to be able to very specifically do queries and research on using your clinical documentation. So we're going to start here with our fracture of the femur concept. And the finding site is the femur. And then that femur structure, how it goes up the hierarchy, how it gets more and more broad. And same thing with our fracture of the femur here. As we go up the hierarchy, it gets more and more broad, because fracture of the femur is fracture of the bone. But then also fracture of the bone here, it's also a subtype of a disease, and it's a subtype of the fracture of the bone. And the fracture of the lower limb here is also a disease. So all of this is inherited. And so these inheritance is called description logic. And this is, and kind of once you kind of understand this, you can use this to your advantage for secondary use of the clinical data. Very cognizant of our time. So I know that we're kind of winding down here, and we're gonna, Susan, there will be time for questions and answers. So, let's talk about the nursing content. So nursing content in SNOMED CT, there's lots of it there. We've got coverage in nursing diagnosis and problems. We've got nursing interventions and outcomes. We've got functional information, which includes our assessments on our patients. We've also got assessment scales. So assessment scales is a whole nother webinar on its own, but just know that there are terms in SNOMED CT to describe assessment scales on multiple different levels. And I have a really good example using the APGAR score, but I don't have it here in this presentation. And then definitely for care plans, because it really, I mean, that's what the nursing content was added to SNOMED CT to support this content. I'm going to kind of pause here and kind of go off my slides a little bit. Nursing content within SNOMED CT was added, I believe, starting in the 1990s. And NANDA was one of the first nursing terminologies to be added into the terminology. So there's been a lot of support for clinical documentation for nursing for quite some time in SNOMED CT. And it wasn't really until in the United States we had something called meaningful use, which really accelerated the adoption of the electronic health record when SNOMED CT and the nursing documentation within SNOMED CT really started to come to light, and the value of that clinical documentation, that coded clinical documentation, became available to people using electronic health records instead of paper records. So within SNOMED CT, there is a lot of community involvement where you can get involved, not only here in NANDA-I, but also in SNOMED as well. There is something called the Nursing Clinical Reference Group. There's clinical reference groups for a number of healthcare specialties, different medical specialties, also allied health specialties, including behavioral health and nutrition support as well. The nursing clinical reference group started back up again about 2 years ago. We are a forum to bring issues to light. And the one I wanted to talk about most recently is at the April business meeting, there was a decision made to move at-risk concepts. So this is at risk for falls, at risk for pressure injury, at risk for abuse. A lot of these terms that are critical for nursing documentation and a lot of the nursing diagnoses. There was a plan to move all of these from the clinical findings hierarchy to the situation with explicit context hierarchy. Now, I know I didn't talk about the situation hierarchy a lot, but like I said before, is a relationship, the hierarchy where a concept resides is part of its definition. Situation with explicit context hierarchy. I was always taught that that's kind of like purgatory for concepts. It's when something doesn't really exist. So it could be, you could put something like, no history of smoking, or family history of breast cancer, or paternal history of dementia. So it's not necessarily about the patient of record, or a clinical condition may or may not exist. So I was always taught you really go to that situation hierarchy at the very end, that's like your last resort. And so that's why I called it kind of purgatory. So when I found out that these at-risk terms that are so valuable to nursing, because that's what we do for our patients, we identify risk, we do risk management to mitigate those conditions from occurring. We fought against it, and SNOMED just had their business meeting in Lisbon, Portugal 2-3 weeks ago, and I'm happy to report the nurses were heard. We did have to fight quite a bit for this, but the nurses were heard, and they are changing or extending the concept model to keep those at-risk terms in the clinical findings hierarchy. So yay, nursing. We stood our ground, and we helped save a lot of the clinical documentation that is so valuable to nursing. And so it's open to all nurses. It is, you're welcome to kind of join. There's nothing to sign up for. I should take that back. Down here below, and we will share these slides with you, is the web link for the page for the SNOMED CT clinical reference group page. You can see when our next meeting is. You can hop on and see what we're talking about, and join in any discussions, because we would love for more clinical terminology representation from NANDA and from any other clinical terminology. We'd love more representation on those calls. So the nursing clinical reference group, we also, like I said, we work across all the clinical reference groups, and provide input for them. They ask, what they have an issue, what does nursing think about it? And we ask them the same questions. And in the last 2 years, one of the big projects that that they worked on was adding the ICNP terminology to SNOMED CT, and nurses provided input on that as well. So it's a valuable group. There's a lot of nursing going on at SNOMED, and we'd love for you to be part of that. I'm just going to close out with another great quote from Humpty Dumpty, and about terminology. And I think it's very appropriate because the words that we choose are very valuable to our clinical documentation to help document our patient experience and the value that nursing brings to healthcare. And I'll let you finish reading this. So at this point, so getting involved, definitely, we're looking to create a NANDA Nursing Informatics committee. If you have any interest in that, please reach out to NANDA, reach out to Susan. I did not put my email address here to reach out to me. I'm not sure why I did that. But Susan will, if you connect with Susan, she will forward your interest onto me. Definitely the nursing clinical reference group at SNOMED. And then also start looking through a SNOMED browser and start looking to see what's in there for nursing, because hopefully I've kind of demystified SNOMED for you at this point. And start by just looking through the browser. You can see what's there, and and what you can find as well. With that, Susan, I'm going to turn it back over to you. Are there any questions in the chat?
Thank you, Christine. What a wonderful presentation. So well organized. You clearly described SNOMED, and of course we enjoyed your humor as well. So I'm looking at the chat. I don't see any questions. So take a minute if you have a question to add, and then we'll ask Christine to answer that question. Absolutely, we want to say hooray, Christine, that at-risk terms will stay in the clinical findings hierarchy. And thanks to you and all the nurses that supported and advocated for that decision. So that's really, really great.
So I do, sorry to interrupt,
Yep.
Susan. I do have a question from Laura.
Okay.
She's not able to use the chat, so I'll go ahead and ask for her. She's asking if, let's see, if there are
It's the Q&A feature, I think, not the chat, just so everybody knows the Q&A
right, yeah,
feature.
but for some reason she can't type in it.
Yep.
She's asking if there are assessment categories that are likely to fall in EG concepts or descriptions.
Can you say that one more time, Melissa?
She's asking if there are assessment categories that are likely to fall in EG concepts or descriptions.
Take it away, Christine.
I'm unsure what she's asking. I'm looking in the QA myself.
I think Laura wasn't able to edit in the Q&A. Melissa, if you can get more clarity on that question, we'll go on to Camilla. Camilla says, hi, Christine, is there a risk of us going back to the context hierarchy issue discussion for our at-risk terms?
Actually, there is, this is so exciting. There is not, because, what they've done is they've extended a concept model to remodel the at-risk terms. So no. So they've not there. I think this issue is dead. We're not going to have to fight this fight again. This fight was very valuable to NANDA, because NANDA includes a lot of at-risk terms, and there's a lot of very valuable at-risk nursing diagnosis that need SNOMED terms in there. And I'm going to answer Astrid's question as well. Camilla, I don't think we're going to have to fight this battle again. Our next SNOMED clinical reference group meeting is November 8th, and I'm going to ask our content manager to walk us through the new concept model for that, because that'll be, and I'll share that with the group, because they're extending some of the attributes so that they can stay in the clinical findings hierarchy. And I'm trying so hard to contain my joy. So Astrid asks, are all of the NANDA diagnosis linked to a SNOMED code? That's a great question, Astrid. And I'm going to say not all of them. And there's a number of answers to that, a number of reasons why. A number of them are, we've been in contact with we've been in contact with SNOMED. We found a couple of issues with the SNOMED concepts, and there's a couple of errors on their part. And then there's a formal request process, which needs to be gone through, so you can request NANDA diagnose, you can request new SNOMED concepts at your national release center level, which is if your country that you reside in is a member country of NANDA, you can request those terms at the national level. NANDA needs to request them at an international level so that all the countries have access to that. And so there's a number of requirements and, policies that we will need to address in order for that to happen. Okay, but that's a great question, Astrid. And we're working on getting all of them.
Christine, can you just speak to whether that's something you're working on or not?
It's something we're going to have to work on at the organizational level at NANDA. I am working on getting the NANDA diagnosis that currently do not have a SNOMED equivalent. I am working on finding equivalents, and if I can't find an equivalent, I'm working on the proposal to NANDA, to SNOMED International, to get added. That being said, now that there's a change to the concept model, I need to figure out what the concept model is, because they've not shared the concept model on the documentation from the the Lisbon meetings. So I can have that as part of the request. And then there's also cross-organization agreements that need to be addressed as well. And that's outside of my scope. So we're working on it. We're working on it.
Perfect.
Okay.
Laura has a question in the chat. Do you see that, Christine?
Assessment categories are mapped. Okay, so so Laura, that is a great question. I think that is, we can kind of do another like 20-minute seminar on that alone. And it's kind of so it's not so. Nutrition, cognition, coping, activities of daily living assessments are all going to be mapped using the same framework. So, so the questions are all going to come from doesn't matter what kind of assessment it is. That question is all going to be mapped the same way. The answer lists are all going to be mapped the same way. If there's any kind of a score, that score is going to be mapped the same way. The title, the topic, they're all going to be mapped the same way. And I didn't want to put that that NANDA that APGAR score assessment in here because it was going to kind of, I was just trying to keep it to the basics so that people could get their arms around it. Because I think this is it's like the next step up is to talk about like how we would do a set. Once you get your arms around what SNOMED is, then we can talk about how to use it with your mapping or with your equivalencies. With that, but that's a good question, Laura. And we can, Susan, that's a great future topic for an educational
Session, webinar.
session.
Well,
Yes, thank
that's
you.
a good segue to say, if you do have suggestions for webinar topics that you're interested in, please let me or Nanda know. I want to thank Christine for this excellent presentation. And I want to remind folks that the presentation will be archived. It takes us a little time to get that in place. I think it takes us about a week. So look for that archived, this archived webinar if you want to review it. And again, please feel free to connect with Nanda if you have questions, webinar topics. Again, we so appreciate your presentation, Christine. I hope everyone has a great day. Thanks much.
Thank you. Thanks for being here.